When it comes to treatment for adrenal disease, it really depends on the adrenal disease itself as to what treatment will be required. But there are a few varieties of treatments available. One is non-invasive surgery, when they go in and actually remove something that's grown on, maybe a cancer or tumor on the adrenal glands themselves. There's also full removal, so invasive surgery, removal of the adrenal glands completely. Then there's medication to either suppress or reduce the amount of hormones that are being produced by the adrenal glands, or medication to replicate the hormones that are no longer producing. If you need those hormones and you don't have them, if your adrenal glands are not producing them, there's medication available to replicate those hormones. And unfortunately, it's not really a one size fits all when it comes to treatments or medication. Medication alone takes, it varies for the individual, but there's a wide variety of brands and types, and each person will have a different response to them. So sometimes it takes a while to find the appropriate dose or the appropriate medication or what time of day. There's so many variables. And I know when it comes to children, a lot of times they take the medication and they grind it up and they put it in like juice or milk or something, so it's easier for them to consume those hormones or the medication, the replacement, whatever it is, or suppressing medication. And then there's also the possibility that you have malabsorption issues, which means that you can't actually absorb anything in your medicine. And when that happens, some people actually utilize injections for their hormone replacement or suppressing hormones. And then there is even the pump, which is kind of a taboo topic in the adrenal world because it's not really, I'm not an expert on it and I don't know all the facts, but I do know that there are some people that don't think the pump is the right way to go for adrenal insufficiency, and there are some people that swear by it. So I think it's a case-by-case situation for the individual, but those that cannot absorb orally, it's a pretty promising alternative. So those are the different varieties of treatments. It will depend case by case on the adrenal disease and the individual itself, because as with most things in adrenal disease, there is no one size fits all. There's a variety of variabilities with each individual.